All right. Welcome to the Alfi podcast, episode 12. We have a very special guest, my friend, Dr. Abigail Rodriguez.
Hello. Thank you for having me. I'm excited.
Thank you for coming. I'm excited too, for many reasons. Being a jaw surgeon, and a lot of our audience is interested in jaw surgery. You had jaw surgery about a year ago, so you are a patient.
Yes.
But you're also a renowned plastic surgeon.
That's a very nice word. I don't know if I'd say renowned, but I'm a board certified plastic surgeon here in Houston, and I solely do aesthetic plastic surgery. So just cosmetic surgery, as a lot of people say.
So this will be good because you have obviously a unique perspective,
right,
as a cosmetic specialist. Obviously, we do the surgery for functional reasons, but I always say function and aesthetics go together.
Absolutely.
So I know we have a lot of patients that are interested in your take on this surgery in particular and its aesthetic components to it. So
yeah,
we'll get into that. But before we get into jaw surgery, I want to know, how'd you decide to become a plastic surgeon?
Well, good question. I did not plan on it. I think a lot of people that you ask knew since they were in the cradle, I want to be a plastic surgeon, and they've had this goal for life. And I think that's great, but that's not how it worked out for me. I went into medical school kind of open-minded. I wasn't quite sure what I wanted to do, and I thought I was going to end up becoming a OB-GYN. Both of my parents are, so it's kind of what I knew. But at the suggestion of my mom, she thought it was a great idea if I took an elective rotation in plastic surgery, because she thought you'll learn how to suture really well,
Right.
And so I did, and I fell in love with it. I was super late to the game. It's a very competitive residency to match into, and I was fortunate to have great mentors that took me under their wing really quickly and helped me get in, so they were fantastic and totally changed my trajectory. So
Yeah.
that's how I got into it.
That's great. So both your parents are physicians.
Right.
They were obviously good role models.
Absolutely.
It's interesting because I see a lot of, we see, being in the medical center, I interact with physicians every day, both as patients and colleagues. And I see a lot of physicians who have children and they steer them away from medicine. I feel that it's rare to see physicians like yourself that their parents were physicians, especially both parents.
Yeah. Well, to be honest, they did not really think it was a great idea. They're like, don't you want to go to law school or something instead?
Right.
Because it's a really long road.
It's a lot of sacrifice.
Yeah. And so I think that's why a lot of parents that are physicians maybe aren't overexcited,
Right.
about suggesting it perhaps. But it was really neat, because once I got my foot in the door and got into medical school, you're going to be a doctor. It was like I entered the club that they were in. And, so it's really actually fun now to talk to them about cases or ask them questions and stuff. So it kind of changed and shifted.
That's neat. And they must have loved their job, even though they maybe didn't encourage you to do it.
Right.
You saw something
Yeah.
there, which means that they were good role models.
Oh, absolutely. I mean, it's unlike many jobs. I think it's a lot of people call it a calling,
Yeah.
It's very different because it's so involved, it's a part of you, and, you go home, but you still have commitments.
Absolutely.
And so, but it's also very rewarding. So you get to see both sides of it.
It is. I think we're very lucky, very blessed. I don't see it as a job. And I think that the physicians that do have a hard time and their children don't want to be physicians is that they do see it as a job.
Right.
Because you got to just love all of it.
Yeah, exactly.
Because, you got to be part of the patient experience. Can't really shut it off.
Well, precisely. I mean, anytime, you need to be available, willing to help. And that's what it's all about.
Yeah, Definitely. And the rewards are tremendous, obviously.
For sure.
What's your favorite procedure to perform?
Well, I think my favorite's probably the drainless tummy tuck. I was fortunate to do my aesthetic surgery fellowship here in Houston at ACPS. And one of my great teachers there, Dr. Patronella, taught me how to do it. And I really love his technique. And so I've implemented that in my practice, and patients really appreciate not having to have a drain or, like a little tube that exits the skin, has a little like collection canister to hold fluid. It's very cumbersome for patients to have to deal with that. So, one of my family members had surgery and they had a drain, and I helped care for them. And so I kind of experienced really how annoying it is to have to shower with that and stuff. So, I think being able to offer that's awesome.
Yeah. Nice. Yeah. It's similar to how we can do jaw surgery now.
Yeah.
Drainless, splintless.
Yeah, exactly. And, it's honestly, it's not necessarily a new technique. It's just a lot of people don't want to maybe take the extra time to do it. I think there's really no reason to not anymore.
Absolutely. Do you see that it's lacking in training in most programs?
That particular
technique?
Yes, I would say so. Just because, plastic and reconstructive surgery is such a broad specialty. I mean, we cover everything from hand surgery to craniofacial
Your scope
surgery.
is insane.
Yeah, it's wild. So, I mean, to get down to the detail of, a certain technique for a tummy tuck, I think is almost a little bit beyond most people's sort of experience in residency, which is, for my kind of one of the reasons, I guess, why I went to aesthetic surgery fellowship, because I wanted to have more, nuance to my technique and be able to offer that higher kind of level of care.
What do most the majority of plastic surgeons that get out of residency, what do most of them do?
A good number of them end up doing breast reconstruction. I think that's a very kind of core component of one of the services that plastic surgeons offer. So I think a lot of them do that. And general plastic surgery includes things like covering up wounds, or reconstructing little defects from skin cancer, that type of thing. So I think those are probably the most kind of common bread and butter cases that people do. Breast reductions is another very popular one that insurance covers. So I think that's the most popular, but I will say in my observation, doing a fellowship afterwards seems to be becoming more popular. Yeah. So whether that's aesthetic surgery or hand surgery, what have you.
Yeah. And I think for good reason. It's I think important to not only specialize, but subspecialize and then do something well, do it a lot. Yeah. And be an expert in that particular surgery.
And it's interesting, when I was starting off in, med school, I would look at some older surgeons and think, that's all they do. They just do these, this like small kind of scope of surgeries. But now I get it.
Yeah.
I mean, you could spend your whole life doing one surgery just to become super, perfectionist and proficient at it. So I'm not so judgmental now,
I
guess. But.
Yeah. I mean, I've seen it in my own career.
Yeah.
Oral surgeries, our scope is not as wide as your scope in plastic surgery, but it is wide. From taking out teeth, putting implants, bone grafting, facial cosmetic surgery, jaw surgery, head and neck cancer. And when I started, it was full scope. I did a little bit of everything. My passion was jaw surgery. And as I narrowed down, now that's all I do. Yeah. I feel like I'm able to do it much better.
Yeah. Well, exactly.
And continue to grow.
Yeah. And I feel the same about, kind of my little slice of the pie, that I've focused on in aesthetic surgery. And I think you can just get better over time.
What was your experience with jaw surgery in your residency?
Good question. So we rotated on our OMFS, or oral maxillofacial surgery team. I think it was 2 months out of our training. And they were super nice surgeons, really great. And they allowed us to, scrub in on their cases that were mostly facial fractures. We shared call with them for that. So that was most of it, but they did do some orthognathic surgery. And it was interesting because at the beginning of my residency training, which started in 2014, they were still using cephs to plan out the surgery.
2D cephs. Used to trace it. Trace them with tracing paper and a number 2 pencil.
Yeah. And so I was like watching them and, taking notes because, we got tested on a lot of those things for our boards,
right.
SNA, SMV, all this stuff.
Mm-hmm.
And so that's kind of where it started. And, we did a handful of cases with them that way.
Mm-hmm.
And I remember towards the end of my training, I graduated in 2020. It was like they were starting to incorporate pre-plan, CT guided,
right. Virtual
surgeries.
planning.
Yeah. So it was interesting. It was just like a shift when I was there. I didn't get to be a part of one because I was kind of, moved on from the elective rotations by that point. But yeah. So a little experience with it, but they were much more involved. I mean, because they weren't using CTs to plan the surgery. It was all,
it was
bending
a lot
the plates.
of work.
And and so my experience with it, I was like, I'm not having that done.
Right.
It was intense, and the recovery was really involved. Being wired shut stuff. So very, very different.
That
from
recovery was a very intimidating recovery.
Yes, absolutely. So I was not interested, I guess. When that was the only option.
Yeah. Was it even on your radar at that time as something you may need or want?
I think it was one of the OMFS surgeons there mentioned kind of offhand, like, well, because he saw I had an open bite. He's like, well, you probably need orthognathic surgery. And I was like,
I'm not doing that.
No way. But nobody else had really mentioned it until I visited with Dr. Krotkin here in Houston.
And how did that go? What did you go to him for?
Well, really just aesthetics. So I just wanted my teeth to look, prettier, straighter, all this kind of stuff. And so he, very thankfully looked at the big picture, didn't just say, oh yeah, I'll shift your teeth and, make them look nice. He was like, we have to address other problems, so he got me connected with you as well as Dr. Shire at Perio Health and started, kind of this whole treatment plan.
Did you have any other symptoms besides the open bite or aesthetics that you wanted to target?
Yeah. Well, I didn't really identify or connect the dots, I guess, for quite some time, but I always felt like my jaw was never at rest comfortably. Like, I think because of all the tension that my jaw was constantly under, it contributed to headaches that I had. So that was one thing I was hoping would improve.
I know when I met you, you were always very stoic.
Yeah. I know.
And, you had a lot of confidence, I think, in the process.
Yeah.
You were, especially for a physician, you were an amazing patient.
Oh, really? Well, we can be the worst patients, I guess.
I know, but you were not. You were.
Well, I tried to actually be very humble about it, and I don't know everything. I'm gonna just be a patient because I think it's dangerous when you start to, get involved too much or something. So.
Yeah, I think so too. But I think you did an amazing job at that. I admired it.
Oh, I tried to be chill.
You were very chill. You were very humble. You seemed to have a lot of trust.
Well, I mean, I think it's important when you're picking a surgeon. Obviously, knew that you were really experienced in this, and I felt, totally confident talking to Dr. Krotkin, Dr. Shire, and then you whenever I met you. So I think that's super important, to going into it calmly, with trust.
And you had a good team.
Yeah. Exactly.
What were some anxieties? Did you have any anxiety going in there that we couldn't see?
Yeah, probably the two big things for me were, number one, work. I knew I was going to have to take off a significant amount of time. So our work as in aesthetic surgery is really, really physical, So today, I operated 12 hours and it's hard work. We're doing liposuction and stuff. So I was like, man, how am I going to do that on a liquid diet, with feeling kind of weak and stuff. So I think that was tough to sort of jump into. And then the other thing was kind of the aesthetics of it. I wanted prettier teeth, I guess, but, I wasn't too bothered about my sort of facial balance or proportions. So I didn't really want that to change dramatically, though I think it does look more balanced now. I was just worried. I know, I guess the knock-on effects, that this part of your nose can look a little bit wider and stuff. So I was just, again, trying to remain calm, but I knew it would change.
When you saw the planning process, because we show you the plan beforehand, did that give you more anxiety or less about how that would look? Did you have an appreciation?
Yeah, no, I think it was helpful because I didn't really want my, my chin to be too far forward or your jaw to be too far forward. So I could kind of see what the end positions would be once you showed me the, the kind of the after CT. It was reassuring because I have looked at many CT scans. So.
Right. Yeah. So you you understand what the balance looks like.
Yeah. So I thought that was helpful.
And how long were you out of work before operating?
3 weeks.
Yeah.
I think I probably could have done it at 2 weeks, but it was a good idea to just play it on the safe side.
Yeah.
Because like I said, it's so
you don't
physical and
Yeah. You don't want to set up a 12-hour day of operating. Yeah. Patients waiting on the schedule for months and you're not sure.
Exactly. So I think that was a good call.
Yeah. What was the recovery like?
It was not that bad in the sense that I felt like I had really no pain. So that was no big deal. I think it's uncomfortable, because it's swollen and stuff like that, but that was no problem. I think the hardest part for me was just the dietary restrictions.
Yeah.
I love food. I love eating out and stuff. So, that was hard, but I sampled all the mashed potatoes in Houston. So,
practicing in Houston, that's one of the challenges because it's such a food city.
Yeah.
Or a foodie city. We have amazing food everywhere.
Like, what am I going to do? That's like my hobby.
Right.
But no, I thought that was the hardest part. I think it was really, I think it taught me to be more resilient, honestly. You have to just, I think, keep a positive attitude and kind of just keep your eyes on the prize.
Yeah. So you got to be disciplined.
Yeah.
But surgeons are pretty disciplined people.
Yeah. I think working out helped a lot. I really tried to up it before surgery, obviously to get kind of best physical condition I could be in before going into the surgery. But also, it just helps with kind of mental stamina and all that kind of stuff too.
How soon were you working out?
I think about 2 weeks afterwards. Yeah.
Anything unexpected about the recovery?
No, not really unexpected. I think it is, as I tell all my patients, it's really, really hard to look in the mirror and kind of like not recognize yourself.
Yeah.
So I knew in theory that like that's something to expect, but it's just a whole different thing when it's actually happening to you. So I think that was just, it was interesting.
Yeah. How long did that process take to get comfortable?
Probably a few months. I think obviously in the beginning there's a lot of swelling. You're like, okay, don't read too much into this, so you have to wait until all that's out of the picture. So I think by about 3 months afterwards, I could really kind of see like, okay, this is probably more or less what it's going to be. And so it just took some time. Now,
what do you see when you look back at old pictures?
I think I just noticed more, that my chin was more recessed and like on my profile, especially, I like it more now.
Good.
It's just an adjustment, you know, you don't really like, if you're not focused on the aesthetics of it to start with, it's like, I wasn't really honed in on it. This was a functional thing. Yeah.
I think that it must be such a gift for your patients when you had gone through something like this. You were a patient, you experienced something. This is real surgery. Yeah. How do you think it's affected the way you practice?
Well, I think I just have more empathy for people, right? And this is also a situation where I didn't have any complications, right? It went totally smoothly. And so I just imagining like if you had a big setback or something like that, I kind of was like in that recovery mode of like, oh, is something gonna happen, right? You have those doubts. And so I think I understand that like concern or that fear a little bit more, just having gone through it. But luckily everything went great for me. Like I mentioned, just looking in the mirror, like I think I can just say that with more really appreciation for like what they're gonna feel. Like it's gonna feel kind of alien, to you to look at yourself and not recognize certain things. But even if it's a good change, it takes time to get accustomed to it.
Right.
So
to be patient, trust the process.
Yeah. And it's like, it's something you wanted. It's a positive thing. It's just new. So I don't know. I think I just can empathize with them more on those things. The vitamins that we like recommend people take. I'm like, oh my gosh, man. If you can't take them all, I totally get
it. It's
okay.
It's a lot.
It's a lot. Yeah. So I have a little bit more leeway on that.
Yeah, that's good. Any advice you would give to patients that are looking into this type of surgery or any surgery?
Well, I think do research. That's always really important. I had like the benefit, I think, of, being a physician, having some hands-on experience with this type of surgery.
Right.
So
you know the inside scoop.
Yeah. But I think it's important to do that research, find somebody that's board certified that really has a lot of experience in exactly what you want.
Right.
I think asking, getting references for that person is really helpful. So, really esteemed, doctors in the community recommended you. So I think that's always a good sign, right? And I think also finding somebody that is evolving and is willing to offer, kind of like new things, like new technology, that's reassuring, because that means that doctor or surgeon is, keeping up or leading the way, in their fields.
It's very active. That's a great point.
And that's you. So
I appreciate that.
Yeah.
Besides the empathy component, do you think that it's changed the way you treatment plan at all?
I think I found that exercise was really helpful, just like I said, not just physically, but mentally, both before and after. And so I feel like I try to emphasize that a bit more and really encourage people to, like move your body, maybe earlier than you feel like is okay, but I just try to be really reassuring about that so that you start feeling more like yourself, sooner. So I think that's kind of a little bit of a change for sure.
Yeah. Have you noticed any breathing or sleep improvements?
Yeah, a bit. I would say it was not one of the reasons that I did the surgery, or, I didn't necessarily need it, I guess, like a lot of patients do for that reason. I think my sleep is more restful now. I'd say I don't really have a problem falling asleep. I'm usually exhausted. But yeah, I think better and more rested in the morning now.
I'm going to go through some questions from our audience. I asked people to give us some questions. What helped your recovery process? Any recommendations? We kind of went over that.
Yeah. Trying to have some variety of protein sources is good, and getting as many different protein shakes as you can, because you're going to get sick of whatever you start off with. Yep.
Most noticeable change for you after?
Well, obviously my bite. I mean, night and day. I had literally just, one tooth on each side that was touching.
Right.
None of the other teeth had any contact. So that's crazy.
Yeah.
Crazy change. But second to that is probably the headaches for me. I mean,
that's huge.
Like dramatically reduced. I mean, I used to have like headaches that would evolve to migraines where it's like I'm throwing up and, really severe. And I haven't had a single one like that since surgery.
That's amazing.
Yeah. Pretty cool.
Oh, that feels good.
Yeah.
I love hearing those stories. Somebody asked, is there anything surgery fixed that plastic surgery couldn't?
Yeah, I mean, I think obviously the bite is not something that we even address in plastic surgery. I think if you were trying to achieve the aesthetic changes that I had from before to after, there's probably a couple things that we could do to sort of simulate it or kind of mask the sort of deficiency of your mandible projecting forward and that kind of stuff with a chin implant or something like that. But, again, it doesn't fix the underlying problem.
Right.
So if I see a patient that has a, really set back chin, and for instance, they're interested in like a neck lift, I suggest they visit with you, or at minimum do something to increase their chin projection, because it's very, very hard to get like a sharper angle here, or more crisp neckline if you have a really set back chin.
Yeah.
So. Yeah.
That's great.
Yeah.
A plastic surgeon looking out.
Yeah, I'm trying.
I like this one. As a plastic surgeon, what are some of the aesthetic considerations jaw surgeons should look at when planning?
Yeah. Well, good question. I mean, I don't know. I think now that you have the CT, planning, it takes a lot of that kind of guesswork out.
Yeah. It definitely makes it easier.
Yeah. I mean, if you were trying to go into it and you were just sort of guessing based on like exam and x-rays and stuff, you may not appreciate like, they have a bunch of filler or something here, right? That's kind of making their cheeks look more projected or chin look more projected or something like that. But I think with a CT scan, all of that's kind of like no big deal. No, I mean, I guess the only thing that I can think of is has to do with kind of the nasal appearance, which I kind of asked you about, because obviously the sort of the profile of the nose changes, and then kind of the width of the alar bases change. So I think, but you're obviously attuned to that.
Yeah.
So, but I think it's important for patients to know, that's going to shift.
That there will be changes.
Mm-hmm.
I saw on your Instagram post, what's your Instagram handle for anyone that wants to follow you?
At Dr. Abigail Rodriguez.
Okay. Follow Dr. Rodriguez. She has a great Instagram. I saw you with some kind of AI.
Exoskeleton.
Yeah, exoskeleton device.
Like,
that's where I was going with that.
Yeah. It's pretty cool. You should try it.
Are you using that?
Yeah. So they have a couple different types, and I've purchased the one that really helps with just kind of general back sort of positioning, and it encourages you to stay upright. So it kind of has like this, solid bar that runs from kind of your shoulder level to your mid thigh,
Yep.
so that you're not hunching over.
Yeah,
And
for 12 hours a day.
yeah, exactly. So it's pretty cool.
That's cool.
Yeah.
Do you feel a difference?
Yeah, I do. You know, there's such long days that by then I'm like, oh, I don't feel so bad. You know,
Yeah.
I mean, it's not a miracle thing, but you know, I think it makes a huge difference, especially if you're going to be using it consistently.
Yeah.
So, yeah.
Any exciting changes in your field that you see coming down the horizon?
Well, I'd say one that has just happened and everyone's really excited about is a new breast implant. So we haven't had a new one in the US for quite some time. And there's really only there had only been 3 brands that were FDA approved. And this is a new one that is like, has incredible data and safety behind it. And it's really exciting to be able to offer patients that. And
it's a different material?
It's just a different kind of technology and design. So the shell of the implant has a very specific amount of texturing to it, 4 micrometers, I believe, that is like perfect to minimize inflammation in the body, so that the capsule that forms around it is less likely to get thickened and, you know, become problematic.
Right.
So very safe and also super low rupture rates. So that's awesome.
That's good.
Yeah.
How often are you seeing ruptures and foreign body reactions?
That's a tough question. I mean, I think maybe about twice a month I'd see somebody that has something like that come into clinic, but there's a huge kind of spectrum, you know, so there can be slight firmness around a breast implant that can signify that, okay, there's some inflammation starting, or maybe that's where it ends. You know, it just gets to that point and nothing further changes, but it can evolve further and worsen in some people. So including those kind of patients, maybe 1 or 2 a month, you know, so it's not super, super frequent that I see.
What are your thoughts on leaving titanium plates versus removing them?
Oh, I don't think it's any big deal to leave them in.
Yeah.
I mean, I had to remove the ones on my jaw just because I could feel it and see kind of a portion of it.
Right.
So, but it was really just more for aesthetic reasons again.
Yeah.
No, I don't think there's any big concern there. I mean, I still have mine on my maxilla.
Yeah.
But
that's good.
do you have
a lot of patients ask that question.
Yeah.
Some have concern about titanium being in there. Obviously, my brother Johnny has it, and my recommendation, it is another procedure to take them out. As far as we know, as long as we know, we don't see problems with titanium, and we've been using it in medicine for a long time.
Yeah.
So obviously if there's any reaction to it, or if it bothers someone, like you noticed it or it bothered you, no big deal to take it out. I recommend taking it out. If someone has any concern about metal leakage over time or anything like that, even if it's a concern, I say go ahead and take it out. But other than that, if someone's not really concerned thinking about it, my recommendation is to leave it.
Yeah. Well, I think a lot of people have similar thoughts on breast implants, you know?
Yeah.
So I think if you have a concern about it and it's worrisome to you, then remove them. You know, it's not worth
consuming.
Yeah, it's not worth it.
It's not worth it. I agree.
Yeah.
I agree. I always end this podcast with my question.
Okay.
Who's the greatest basketball player of all time?
Probably Kobe Bryant.
Some bias here.
Yeah. I'm like, I don't know. You tell me. I'm going to go with the context clues here.
Yeah, exactly. Thank you very much for coming. I think this is going to be really exciting for people to watch.
Well, I hope it's helpful. Yeah. And I appreciate you taking the time to talk with me. It was fun.
Thank you. And if you need a good plastic surgeon and you're anywhere in the States, you can travel to Houston. It's easy to get to. And reach out to Dr. Rodriguez. She actually treated one of our staff members and made her look 15 years younger. And she's very happy with the care you gave her.
Yeah.
And we noticed the difference. I think it's done a lot of good for her as a whole.
Good. Well, that's the whole idea for sure.
Yeah.
Yeah. I appreciate it.
Thank you for coming.
Yeah. Thank you.